Adam Grant is an organizational psychologist at Wharton, where he has been rated top professor for 7 straight years. He's also a New York Times #1 best-selling author. His pioneering research has inspired people to rethink fundamental assumptions about motivation, generosity, and creativity. His latest book, Think Again, The Power of Knowing What You Don't Know, is about our beliefs, urging readers to be open-minded and to examine the art of rethinking. Adam, welcome.
Thanks, Joao. Great to be here.
Hello, and congratulations on the book. It's a fantastic read. And one of the core messages in the book is that when it comes to our beliefs, we should avoid what you call preaching and prosecuting and even debating our beliefs with others like a politician would. And you say we should rather think about them as a scientist would. Well, what do you exactly mean by that?
Well, the original framework from my colleague Phil Tetlock captured a dynamic that we've all experienced, but I never had a vocabulary for before it. You're in preacher mode when you believe you've already found the truth and you're trying to proselytize to others. You're in prosecutor mode when you're trying to win an argument and prove your case. And if you spend a lot of your time thinking and talking like a preacher or a prosecutor, you're not going to do that much questioning of your own views because you think you're right, everybody else is wrong. They're the ones who need to change. When I talk about thinking like a scientist as an alternative, I don't mean that everyone needs to go out and buy a microscope or a telescope, or even walk around wearing a white lab coat, right? For me, thinking like a scientist means that you don't let your ideas become your identity, that you value humility over pride and curiosity over conviction, so that when you have an insight or a belief, you just recognize that's a hunch, it's a hypothesis waiting to be tested. And then the hope is that you're curious enough to go out and discover new things, observe, run experiments, and that really pushes you to look for reasons why you might be wrong, not just the reasons why you must be right. It invites you to listen to the ideas that make you think hard, not just the ones that make you feel good. And it pushes you to surround yourself with people who challenge your thought process, not just the ones who agree with your conclusions. Wouldn't it be amazing if we had more people doing that right now?
And I guess the people who don't do it is something that you call the Dunning-Kruger Effect, right? So, which happens when we don't really have a lot of expertise on a certain subject, and yet we're brimming with overconfidence about it. And guess, bringing this back to healthcare, I guess most of us, we have our healthcare to manage, and we try to be healthy and eat well, etc. But most of us aren't doctors. We're not medical experts. So how does that affect the way we manage our own health?
Well, I think the first thing to recognize is that people who are completely ignorant don't become overconfident, right? If you know nothing about health, then you're pretty clear that you don't know anything. It's when you gain a little bit of knowledge that your confidence tends to rise faster than your competence. And pretty soon you're overestimating how much expertise you actually have, which makes you too convinced of your own opinions, too reluctant to listen to experts, and too hesitant to learn or change. I think one of the places where I've seen this is around simple behaviors like hand washing. So long before COVID started, my colleague Dave Hoffman and I went into some hospitals, and we wanted to motivate doctors and nurses to wash their hands. And we said, okay, the simple thing to do is to remind them of the risks of not engaging in proper hand hygiene, that you can get sick. So we put signs around soap and gel dispensers throughout the hospital that said that if you wash your hands, it's going to protect you from getting a disease. And it had no effect whatsoever. These doctors and nurses had a little bit of knowledge that they'd spent a lot of time working in hospitals. They didn't get sick that often. And over time, they fell victim to this illusion of invulnerability. And they would actually say things like, well, I'm a doctor, so I'm protected. Like that makes any sense. As if they had either had superior immune systems to begin with, or they had developed them over the process of working in medicine. And I think this happens to a lot of people, right? That over time, they convince themselves that they're invulnerable because they don't want to admit that their own health is at risk. We found that there was a different sign that was effective. Instead of highlighting the consequences for you, we actually emphasized the consequences for other people. So the signs that we used here were that if you don't wash your hands, that patients are actually being put at risk. And it's a lot easier for people to recognize others' vulnerability than it is their own. They were a little bit less overconfident that they're vulnerable patients, right? We're not going to get sick. And they were significantly more likely to use soap and gel to wash before and after patient contact. And we've seen recently during COVID that at least in the early months of the pandemic, the don't spread it message was more effective than the don't get it message. And that also with social distancing, encouraging people to protect others by social distancing, as opposed to just protecting themselves, seem to be effective. And so I think we need to recognize that people have a hard time accepting their own vulnerability, but they're much more aware that others might be at risk. And that's when overconfidence tends to fall a little bit.
And it might be not, but is this related somehow to sometimes the seemingly overconfidence that people that a year ago would know nothing about vaccine or epidemiology, and suddenly they're the world's top experts, and they're reading everything from WhatsApp to spam email about all this stuff, and somehow they feel that they have quite the expertise. Is that related?
Yeah, I think it is. I think one of the things we see when we study how people develop confidence is as they start to consume information, they tend to assume they know a lot of things that they don't. They carry around what psychologists will often call the illusion of explanatory depth, which is a sense that you understand a phenomenon or a system in much more detail than you actually do. And one of the fun places where this has been studied is just asking people to explain how everyday things work. Like, how is the audio being transmitted from you to me right now? Or how do the keys on a piano make music? And if you just ask people, how well do you understand the workings of virtual technology or of cell phone signals? Or how well do you understand how a piano works? They'll say, pretty well, at least as well as the average person, maybe even better. If you ask them to walk through the mechanisms, though, and say, okay, well, give me the step-by-step. When you're talking right now, how does that sound get beamed across the pond? They really struggle to do it. And as they struggle to explain, they start to recognize that they know less than they thought. And that's when they become a little bit less polarized. They become a little bit more open to seeing the nuances in the topics that they're learning about. And they become more comfortable being humble and admitting the things that they don't know. And I think that's something we could probably benefit from a bit more of in the world right now. And so there's real value when people claim to know something, instead of just arguing with them or trying to prosecute them, and just asking, can you explain to me how that works?
And tell me, how do you think your findings apply to the relationship between doctors and patients? Even though doctors are expected to align closely, perhaps, with a scientific mode of thinking, is that usually the case, you think, when they engage with patients who don't really know nothing and are in a vulnerable position sometimes?
I think it's going to depend a lot on the patient, but some of my favorite research on this is in the context of what's called motivational interviewing, which originally came out of counseling psychology. And the basic idea is that it's very hard to force someone to change their mind. You're much better off trying to help them find their own motivation to change. And usually that starts with an attitude of humility and curiosity, right? I don't know what's going to motivate you to change, and I'm really eager to find out. I'm also trying to maintain your freedom of choice. And I might come into a conversation, let's say, for example, I'm a physician who's worried about you not vaccinating your kids. What I might do, if you look at the research of Arnaud Gagnard and his colleagues, is come in and say, look, I know there's a lot of misinformation out there. I know it's very confusing to understand the risks of a vaccine versus the risks of not getting vaccinated. Would love to understand what information you have first. And I know that as a parent, you want what's best for your children, and I respect that, and this is ultimately going to be your free choice, and I want what's best for your kids too. And if you look at what happens in these motivational interviewing conversations, parents will then start to explain their information and realize there are gaps in their knowledge. They'll start to also recognize that some of the sources they're relying on are maybe not credible, or they don't even remember where they read something. And at some point in the conversation, Arnaud has been called a vaccine whisperer, or a less abrasive Socrates, which I thought was a great description of what he's doing in these conversations as a physician. At some point in the conversation, after listening in a non-judgmental way, he'll say, could I have your permission to share a little bit of information with you from my expertise? And once they give him permission, it's a conversation, right? It's not an attack. It's not an onslaught. And he's earned the trust of his patients by listening to them. And I think we all know intuitively that people generally do not listen until they feel heard. But there's a little bit of a knowing-doing gap that we see with medical professionals all the time, where they may recognize that people need to be listened to in order to actually listen, but they may not act on that knowledge as often as they should.
And I guess a lot of people today, they will find that information on social media where there's very little nuance or complexity. Indeed, in the book, you mentioned that the initial hope for the internet was that it would expose us to different views and perhaps eradicate most of the misinformation and extreme positions. The reality is rather different.
Yeah, the internet has definitely exposed us to different views, but on average, those tend to be the extremes on both sides, right? And this is true in the news media, not just in social media, that in general, it's the extremes that tend to get amplified and get a lot of attention. And for a long time, I assumed that that was a solution to the polarization problem. If people are, extreme and entrenched on one side, we need to show them the other side. And I've rethought that. I now think that seeing the other side is actually not only failing to solve the problem, it's actually exacerbating the problem. Because when you see the other side, it creates a caricature. It pushes us into what psychologists call binary bias, where we take a very complex spectrum of beliefs or attitudes and we oversimplify it into two categories. And if I have a choice, let's say I'm strongly opposed to vaccines, and you show me the views of somebody who's very passionate about vaccines, well, where do you think I'm gonna hang out, right? I'm gonna prefer the camp that I'm already locked into. If, on the other hand, you can complexify that spectrum and say, actually, there's a whole range of views on vaccines out there. There are a lot of parents who are comfortable with some vaccines, but not others. There are many people who are comfortable vaccinating, but just worried about overwhelming the immune system of a newborn, especially if they're under birth weight. Then all of a sudden, I can stick to some of my beliefs and be flexible on others. And I don't think we've done a good job showing those multiple views. I think what we want to do is look at disagreements not as two sides of a coin, but see them through multiple lenses of a prism. And anytime I hear people say, well, let me show you one side and the other side, or it's us versus them, what I want to know is what's the third angle and the fourth perspective that's missing from that conversation. And if we can open that up, there's a lot of evidence showing that people are more likely to moderate their own views, they're more likely to open their minds. There's even evidence, for example, that if you take a really charged issue like gun control, and you present it not as a one side, other side issue, but as a complex issue with many different points of view, that people then who disagree on abortion are dramatically more likely to find common ground in a discussion together. So I think that idea of complexifying the narrative is something we should be thinking a lot more carefully about.
That's a really interesting point in terms of giving space and giving air to all the nuance and complexity. But we then face an obstacle, a fundamental one in terms of media, because if you go to a newsroom, you only have 5 minutes to tell your story. If you go on Twitter, you only have the X number of characters to send a tweet. You find those physical obstacles to actually talking about nuances and complexities, and even people's time sometimes. Do you think there is a fundamental issue there?
I definitely think it's a challenge, right? I'm not going to pretend that we can always capture complexity in a 12-word headline, right, or in a 280-character tweet. I do think, though, that there are small signals that we can send to show the complexity. There's research, for example, suggesting that when we're communicating about science and health information, just saying, the researchers believe that more evidence is needed, or there are some caveats, is enough to still make people interested in learning. But also keep them from locking into one point of view and allow them to stay open to recognizing, knowledge is always evolving. Science is self-correcting, but it's not always efficient in doing that. And so I've got to stay receptive to learning different things. I think the other thing that would probably be helpful is, as we think about complexifying in the media, is let's amplify the middle of the spectrum, right? And instead of taking the two extremes on the tails, because it drives controversy and often leads people to feel outraged, which we know is good for engagement and attention. Let's think about what's good for learning, what's good for getting people to have more open-minded disagreements, or even to disagree with their own arguments. And that seems to be really capturing some of those nuanced, ambivalent, complex views, which I don't think we've done a good job telling stories about. And I defer to you on how to do that best, because this is your expertise, not mine. But it seems like at least a question we should be exploring is how do we make the nuances and the people who have very complex views, how do we make those more interesting?
Indeed, I'm going to ask my editor to give me more words to tell my stories. But yeah, it is an issue. Your findings are really interesting. I was wondering about the global, not the global, but are there regional variations to the stuff that you found? In the same way that we find that vaccine hesitancy is different in places like when you would expect perhaps in France and Germany. Do you find also regional variations to the stuff that you found in the book?
Well, let me try to take my own advice here and say this is something that needs a lot more research. I can tell you that in general, there's a bit of a west-east divide when it comes to the idea of seeing divides in the first place. So the further west you go, the more likely people are to fall victim to this binary bias and really like to see dualities, whereas as we move east, there's a little bit more dialectical thinking. There tends to be a little bit more acceptance of contradiction or of paradox. And I think that's obviously something we want to try to spread west. But this is, I think, something that as social scientists, we're just beginning to grasp and try to grapple with, okay, how do we think about tailoring the way that we communicate and complicate conversations to different cultures, different norms, and different ways of thinking?
So you write in the book that after you had finished it, the coronavirus had happened in the meantime, and you became curious about how leaders communicate during a crisis. So what are conclusions so far?
Well, I think we know a lot less than we would like to, and than we need to, frankly. I think there are at least 2 papers that have been striking, showing that female leaders have been more effective during the COVID crisis than male leaders have. There's evidence that both, if you look cross-nationally, countries that had female heads of state actually had lower mortality rates in the first few months of the pandemic, and then also in the 50 US states, that female governors were quicker to announce lockdowns. They also got more compliance when they did announce lockdowns, and that predicted lower mortality in those first months of the pandemic as well. Now, relatively small samples of female leaders, which is a problem in and of itself. But if we look at what's going on behind the communication, we see that on average, women tended to use more confident humility than men. They would come out very early and say, look, we don't understand COVID yet. We don't know exactly what's causing it, how it's spreading, how severe it is, and so we don't want to take any risks with your health. They also showed more concern in doing that, right? Saying we are worried about your safety, we're even worried about your freedom, and we actually think that shutting down is one of the best ways to keep you free from COVID. And not surprisingly, when people feel cared about, they're more likely to comply. And then also we saw that over time, that really bought these leaders the freedom and flexibility to change their minds. They didn't get accused as much of being flip-floppers or hypocrites, it seems, because they said at the outset, look, we don't know yet. We're confident that we're going to figure this out, but right now there's a lot of uncertainty, and we'll continue revising our policy as we get new information and better evidence. And I think that, that's something, I don't think there's anything essential about this when it comes to gender, right? I don't think that women are born more confidently humble. I don't think that they're born more caring. On average, they tend to be socialized to be that way, right? We know gender stereotypes punish women for being, too self-promoting or too overconfident, and for failing to show care. And so they learn to do that. Also, women on average, because of all the barriers they face, have had to be that much better at leadership in order to break those glass ceilings. And so I've looked at leaders like Jacinda Ardern in New Zealand and said, okay, these are habits of communication and styles of leadership that all of us could learn, regardless of what gender category we happen to identify with.
So is your next book going to be about this new paradigm of leadership, do you think?
I don't know. It could be. I hadn't really considered that as a book topic, but it might be something I should rethink.
Okay, I'll get a cut if you do. Let me ask a few questions from the audience. So a few speakers talked about the lack of trust in the COVID vaccine from certain groups more than others. What's your take on flexing between general awareness and targeted marketing to these groups?
I think this is really hard. The research that's coming out right now is telling us that there are a couple of messages that do seem to be effective, regardless of source. One of those is that you have a responsibility to reciprocate the sacrifices that healthcare workers have made. And what I think is interesting about that is it appeals to this law of reciprocity. It also focuses on a group of people that, regardless of what your political views are, we all agree healthcare workers have made massive sacrifices over the past year. And so I think there's potential there. There's also there's some new evidence by my colleague Katie Milkman and a team that she's part of looking at flu shots, showing that of a couple dozen messages they tested recently, their most effective message was a flu shot has been reserved for you. And people, once they heard that, they felt this tremendous sense of loss aversion. Wait a minute, there's one reserved for me. If I don't get it now, I might miss out, and I don't want to miss out. So I wonder if there's application there for COVID. I think the other thing that's jumping to mind for me right now is there are a lot of people who are afraid of the vaccine. right? And I think that instead of denying those fears, we should do a better job acknowledging them. We do not know what the long-term risks are, right? We don't have a time machine. We can't fast forward 20, 30 years and try to guess. I think instead of dismissing the fears, what we ought to be doing, and this, I haven't seen a direct experiment on this yet with COVID, but informed by the last couple decades of social science of persuasion, I would say that we want to acknowledge the fear and say, you're right, we don't know. We don't know what the long-term side effects are. You know what else we don't know? What are the long-term effects of getting COVID? And those are actually really scary if you think about the possible neurological damage that COVID could be doing from some of the early indicators that we're getting. And so what I'm trying to do is weigh the long-term risks of the vaccine against the long-term risks of COVID. And I don't think that's as clear-cut as it might sound to you. And that seems like a conversation or a message that at least is worth experimenting with and testing.
Yeah, you're absolutely right. One final question from the audience, and this is about, you're a psychologist, so what is the biggest psychological sort of trend or impact that you've noticed in the population in general, which has been accelerated last year because of COVID?
I think probably the biggest trend is that people are most likely to listen to sources that they trust, right? We've seen a decline in trust of institutions across lots of countries. It's not just government, right? It's also sometimes scientists, it's sometimes the media. And so I think our default assumption has been, okay, you want to have someone persuaded by somebody in their community or a family member or a friend that they already look up to or listen to. But I think that's actually not the right conclusion. I think the right conclusion is the people that anyone you talk to, no matter who you're speaking with, the person they trust most is usually themselves, right? So people need to generate their own reasons for change. They need to come up with reasons that they themselves find convincing, and they need to have ownership over those. So shoving logic and data down people's throats, we always knew it wasn't effective. I think we're seeing the consequences of that on a scale that might be unprecedented in our lifetime. And so just recognizing if we can help people generate their own arguments for why they want to shift, we're going to be much more effective than trying to give them our arguments, right? So don't preach your values, appeal to people through the lens of their values.
In other words, think again. Your new book is out now, comes highly recommended to my audience, to the Wired audience. Adam, thank you so much for joining us. It was a pleasure.
Thanks for having me. I hope you don't rethink that.